Broadcasting live. It's America's longest running talk show on computers. It's Computer America, bringing you the biggest names in technology with guest interviews, new products, and your emails. Listen live at computeramerica.com on any device around the world. Email the show at live@computeramerica.com or find us on social media. Be sure to check out our website for contests, giveaways, show notes, live video stream, podcasts, and more. You're listening to Computer America.
Hello and welcome everyone into the Computer America Show. We are the nation's longest running, nationally syndicated radio talk show on computers and technology. And everyone, hey, did you miss me? It's been forever, I know. Everyone, welcome into the program. I hope that you're doing well and you are ready for today's show. Because today, you may have guessed, it's Friday. We have the one, the only Mr. Ralph Bond. And he'll be joining us here to talk about four amazing different stories. And, unlike, other shows, and this is not the first time this has happened, so don't panic. We really enjoy the field of medical technology, and that's really going to be highlighted here because today's show is all about medical breakthroughs and advancements. So if you are looking for, something to get you disappointed, sad, upset, angry, all these related similes, well, look elsewhere because we got some really fun, good, light shows for you today. So with that being said, computeramerica.com, that's where you'll find everything, including past shows, future shows, show notes, articles, just everything that we do here at Computer America, computeramerica.com. And of course, we have a whole segment dedicated to Ralph. We'll be talking all, if you want a more Ralph-focus-centric experience, then hey, click that and you'll find all of Ralph's shows. And, as we sometimes like to say, these stories, even, from a year ago, are, still relevant because they're so kind of future looking. And don't get me wrong, sometimes we talk about, stuff that's happening here today now that's, that you can check out. But some of this is in the lab and going to happen. So, yeah, if you want to find out more, computeramerica.com. Let's go ahead, bring Ralph on. And, of course, he is a longtime Computer America contributor and, of course, our science and tech trends correspondent. Emphasis on science because this is medical. So, everyone, welcome back onto the program, Ralph Bond. Ralph, how you doing? How you been?
Doing great. And as you said, today it's going to be a little different because it's going to be the All Medical Miracles show for today. And again, as Ben said, if you're looking to be sad, depressed, and angry, this is not the show for you because what we do every Friday, and today it's going to be medical, but what we do is we look at trends, where we're going, early research in robotics, medical technology, which will be today's focus, sustainable energy technology, transportation advances, space research, physics, you name it. And again, we're going to leave you feeling good. And friends, if you're listening to us as a podcast, I can't stress this enough. Please come out to computeramerica.com. Get what we call the show notes. The show notes will have all of the highlights I've extracted from the four articles we're going to look at, but it'll have links, pictures, sometimes links to videos as well. And this will really expand your experience and give you an opportunity to dig deeper if you wish to, because what Ben and I do here is we just give you the highlights, the top points from each of these four articles.
Absolutely. And, all these, again, you can find on our website. And if you want to find out more, hey, check that out. You'll have everything. Ralph does a good job putting these things all together. I say we just jump right into it, Ralph. There's really no need to kind of preamble this. You have some amazing stories that definitely flew right past me, and I'm glad that you picked them up. So, yeah, story number one.
This first story is so inspiring. It's a jaw dropper, frankly. I got it from livescience.com.
Well, more headline. Below the jaw dropper. Yeah.
Yeah. Oh, yes. Good point.
Rim shot. If I had it saved to my soundboard, rim shot. But there you go.
It's a throat dropper.
Yes.
Anyway, so the headline here is new self-powered throat patch could help people speak without vocal cords. You're going to see why this is so important. Great illustration in the show notes from the article. And here we go. A new flexible device that clings to the neck can translate muscular movements into speech, enabling people to talk without using their vocal cords. Researchers at the University of California, Los Angeles, good old UCLA, the small patch not only detects the movements of the throat associated with speech, but also harnesses that movement to generate electricity, meaning the device can be operated without a battery or being plugged in. Already, this is just so profound. Wow. Okay. The device, described in a study published March the 12th, just last month, in the journal Nature Communications, and again in the show notes, we have a link to that. This device could theoretically help people with voice disorders caused by damaged or paralyzed vocal cords. It could help them communicate, including those recovering from throat cancer surgery. Wow. It's just, what can I say? The lead study author, the lead person involved with this, a fellow named Jun Chen, Chen, who's an assistant professor of bioengineering at the University of California, Los Angeles, says the idea for the patch arose after he'd spent several hours lecturing and felt his voice becoming tired. He began to imagine a way to solve this problem, to make it possible for a person to, quote unquote, speak without using their vocal cords, which are also known as vocal folds, if you want an alternative term to be more geeky. So how does it work? This is great. Scientists have known, a little background here first though. Scientists have known that the magnetic properties of some rigid metals can be changed when they're put under mechanical stress. For example, this is an alloy of iron and gallium called galvanol, whose magnetic state changes when you squeeze or deform the material. So that's rigid material put under stress generates a magnetic state. But in their 2021 study, this predates where we are today, Chen and his colleagues showed the same concept could work with a soft material made of tiny magnets embedded inside thin silicon. So this is all setting the stage for how do you generate the electricity to make this device work, but yet make it soft and flexible. That's the point of that little paragraph here. And now, here we are today, in their latest study, the team has harnessed this material, meaning the thin silicon, in a patch that responds to the subtle stress placed on it by the movement of throat muscles. When a person executes the movements needed to talk, the material responds by producing electrical signals that can be translated into speech. And we're going to learn how that's done in a moment here. Ben, this just blows my mind.
And for everyone watching the video, I'm like sitting here trying not to, but I really want to. Like, I guess I want to, and like you said, you're about to get into this. I'm guessing you like make the mouth movements of talking, but you don't do like the forced air out, I guess.
I wasn't sure. You know, I suppose if you had paralyzed vocal cords or damaged vocal cords due to throat surgery, you could simulate, you know, trying to speak. I tried to see, how could I do this without speaking? And I couldn't because, again, I don't have that, thank God, that disability. But apparently...
The only thing I think is like, you know, you make the movements of talking, you know, but you just don't force any air out. So you just, you know, kind of move your mouth. And I guess that's just subtle enough that the muscles in your neck kind of can be translated. I don't know. It seems like a far stretch.
Blows my mind.
Yeah. I mean, hey, if he can get it done.
Yeah, no kidding. A real stretch, no pun intended, but you're right. So to accomplish this amazing feat, the patch is made of 5 very thin layers, so 5 layers. The outer layers of the patch are made of a soft, flexible silicon material, while the middle layer, made of silicon and micromagnets, and if you have the show notes, you'll see that they're tiny little dots, generates a magnetic field that varies with the movement of the throat muscles. The 2 layers surrounding it, made of coils of copper wire, translate these magnetic field changes into electrical signals. There's your power source, okay, through the movement of the patch. These electrical signals then get fed to a machine learning algorithm, there's your artificial intelligence, that translates the pulses into speech. To train this algorithm, each participant in the study repeated 5 short phrases 100 times each, while the program tracked their throat movements. This taught the system to associate specific movements with a given phrase. Now, Ben, probably as they go on and research, that they would have to have the test participants do many, many more things than one particular phrase in order for the system to understand all the nuanced throat movements that represent all the majority of the words we use in common every day. For example, English speech or other languages as well. But wow.
Yeah, and well, I do like that it's customized to each individual person, or at least that's kind of where the research is leading to. But Ralph, and as as the scientist was kind of talking about, this may not replace a lecturer standing in front of a bunch of students talking about very complex ideas, and it may not solve his problem of being having a sore throat, but maybe for cancer patients, people who just want a basic level of communication that they can't have before, water, exercise, bathroom, whatever. This could be something that basic phrases and basic words and ideas can come out of, and that's exciting.
Something? Yeah, it is. It's a great example. We so often think of prosthetics, replacements for your arm or exoskeletons to help you walk or those kinds of things. We forget you can have a vocal disability, and that's a field that really I think could have wonderful potential benefit.
For sure. So very, very cool research, and it looks pretty cool as well. As far as like prosthesis goes, this is not some kind of like big collar device that's like, hanging around your neck.
Isn't that something?
Very subtle. And of course, I'm sure that you could even make it like skin toned, and it would be even less noticeable. So very cool idea there.
Love it.
So story number 1, I like that a lot. Story number 2, let's go ahead and jump into cardiac tissue, and this is something that is near and dear to potentially everyone's heart, but also Ralph's heart. Over his time here at Computer America, he's had some medical stuff, and I'm sure you can tell people better than anyone, Ralph, that monitoring your heart is something you like to do at all times, not just like, oh, I guess I'll check it out. It's Tuesday, I might as well check it on my heart. No, constant monitoring is kind of like a lifeline and reassurance.
Right. And this story, by the way, will set the stage and then make a few more comments. This comes from medicalexpress.com. Headline: a bioelectronic mesh capable of growing with cardiac tissues for comprehensive heart monitoring. So this story has kind of a complex multi-layer thing going on here. It's going to talk about current technologies to monitor a heart for people with very severe conditions where they really literally need to monitor the heart directly and in contact. But it's also going to talk about this impact of this research for the pharmaceutical community. We'll understand that in a moment, and so on. So it's a kind of a nuanced multi-layer story.
I see.
But here we go. Yeah, it's cool, though. The heart, of course, is very sensitive to therapeutic drugs, and the pharmaceutical industry spends millions of dollars in testing to make sure that its products are safe. Thank goodness. However, ways to effectively monitor living cardiac tissue, that's extremely limited and very difficult. In part, this is because it is very risky to implant sensors in a living heart, but also because the heart is a complex kind of muscle with more than one thing that needs monitoring. Now, here's the problem. But today's sensors can typically only measure one characteristic at a time. And a two-sensor device that could measure both charge, meaning electrical signal, and movement of the heart would be so bulky as to impede the cardiac tissue's function. There's your problem. Today we've got sensors, but they're invasive. They can only do one measurement at a time. What they really need is charge and movement, and that's just today. So it's not like bulky. A meat thermometer where you just kind of shove it in there and just kind of hope for the best. No, it needs to be much more contoured, I guess, nuanced. Yes, and so again, until now, there was no single sensor capable of measuring the heart's dual properties of charge, meaning electrical signal, and movement without interfering with its functioning. So that's the monitoring part of the story. A team of engineers led by the University of Massachusetts Amherst, and including colleagues from the Massachusetts Institute of Technology, good old MIT, they recently announced in a publication called Nature Communications, and in the show notes, we have a link. Again, come out to computeramerica.com. Get the show notes if you're listening to us as a podcast or viewing the video. You can learn more. So they announced in this article that they have successfully built a single sensor tissue-like bioelectronic mesh system integrated with an array of atom-thin graphene sensors. Atom-thin, what? Oh, man. This tissue-like bioelectric mesh system can simultaneously measure both the electrical signal and the physical movement of cells in lab-grown human cardiac tissue. Time out. What we do in this show on Friday is talk about trends, early research. Most of the time, it's early research. That's what we're talking about here. We're talking about them developing this mesh monitoring system and testing it on lab-grown human cardiac tissue. We haven't done this, or they have not done this yet with living human patients or animals. So this is very, very twinkle of the eye early stuff, right? The new device is built of two critical components. The first is a three-dimensional cardiac microtissue grown in a lab from human stem cells. The second critical component involves graphene, good old graphene, a pure carbon substance, only 1 atom thick. What? Graphene has a few surprising quirks to its nature that make it perfect for a cardiac sensor. Graphene is electrically conductive, and so it can sense the electrical charges shooting through the cardiac tissue. Now, folks, this is really deep and geeky stuff. If you really want to, if you're a medical professional, want to dive into this, come get the show notes, get the link, and dive into this paper that was published by this team. Now, this system they've created, this mesh, is piezoresistive, which means that as it's stretched, for example, by the beating of the heart, its electrical resistance increases. In a research first, the tissue-like mesh can grow along with the cardiac cells, allowing researchers to observe how the heart's mechanical and electrical functions change during the developmental process. So again, there's multiple layers to this. The new device is a boon, potentially, for those studying cardiac disease, as well as those studying the potentially toxic side effects of many common drug therapies. There's where the pharmaceutical industry is interested in this research. And to conclude here, one of the lead researchers noted, quote, "No one has ever done this before. Graphene can survive in a biological environment without degrading for a very long time and not lose its conductivity. So we can monitor the cardiac microtissue across its entire maturation process." So that's talking about where they are now with the lab-grown heart tissue and this testing of this mesh, which is going to monitor both electrical charge of the heart and movement in one sensor. So very early, where does this go? We'll see. But someday there might be a very non-invasive, very multifunction sensor for monitoring cardiac health and conditions, and also for drug therapy testing and so on. So a great story.
Yeah, I'm curious because in the world of medicine, I'm sure we've done a lot of stories that it has a lot of promise. In battery technology, really graphene has so many different uses, and in the body has kind of happened before, Ralph. I have also heard reports that graphene is a little tiny bit carcinogenic. So I would be curious to see, kind of what happens with that, and if they can make it a way that it's not as, kind of carcinogenic. I don't know. And obviously this would be for testing, and this would be for in extreme cases. They're not advocating everyone out there go out and get some graphene augments. But still, very cool research, and it allows them to get data that they would not be able to get otherwise, which is important in itself. I'm curious, Ralph, and we'll leave story number 1 at that. We'll see where that one goes. Or I'm sorry, story number 2, and see where that goes. So there you go. Story number 2. Story number 3. And very similar to story number 1, it's adhesive, goes around the skin, and let's go ahead and talk about maybe the future of bandages. Maybe, I don't know. This has some fun implications.
Yeah, you're going to find out this actually has more to do with your internal organs, like your intestinal tract and so forth.
Ultrasound. I'm sorry, but yeah, story number 3.
That's okay. Yeah, we've done a lot of advanced Band-Aid stories. You're right. But this one's different. We're going to go inside with this one. So here's the story. This comes from Northwestern University, their press site. Wow, Northwestern University, salute to you guys and gals. You folks are doing some amazing stuff. We've covered your research in previous shows over the years. But here's the headline: shape shifting ultrasound stickers detect post surgical complications. First of its kind device tags or can monitor an internal organ to monitor abnormal, life threatening fluid leaks. This will all make sense as we go into the story. But again, if you are watching the video, we've got a great image that Ben's showing you right now on the screen of this device with the little dots on it and so forth. Fascinating. So here we go. Little background. All gastrointestinal surgeries carry the risk of anastomotic leaks. That's the geeky term for just a leak. If the leak is not detected early enough, the patient has a 30% chance of spending up to 6 months in the hospital and a 20% chance of dying. Okay, that's a problem. Wow. And it gets even worse. For example, for patients recovering from pancreatic surgery, the risks are even higher. A staggering 40 to 60% of patients suffer complications after pancreas-related surgeries. It all has to do with leakage. Okay? Currently, no existing methods can reliably and non-invasively detect anastomotic leaks, which again are a life-threatening condition that occurs when gastrointestinal fluids escape the digestive system. And we all know what's going on down there. It's acidic. It's very destructive if it gets out of the...
You want the digestive fluids not to digest outside the stomach. That's a big one. That's a big one.
That's right. You're absolutely right. So there's the problem, okay? So researchers led by Northwestern University and Washington University School of Medicine in St. Louis have developed a new, first of its kind, tiny sticker comprised of a hydrogel with embedded tiny metal dots. And again, Ben has that up on the screen for you to see. The new sticker enables clinicians to monitor the health of patients' organs and deep tissues with a simple ultrasound device. You'll see why those little metal dots play a role in this whole ultrasound monitoring. Now, here's how it works. When attached to an organ, the soft, tiny sticker changes in shape in response to the body's changing pH levels, which can serve as an early warning sign for post-surgery complications such as anastomotic leaks, so leaks of the gastrointestinal system, or the pancreas area and so on. In specific, as the hydrogel swells in response to changing pH levels, the metal discs will move apart. And then clinicians can then view these shape changes reflected by the changing positions of the embedded metal dots in real time through ultrasound imaging. As one of the lead researchers noted, quote, because the acoustic properties of the metal discs are much different than those of the surrounding tissue, they provide very strong contrast, I'll add patterns, in the ultrasound images. In this way, we can essentially tag an organ for monitoring. So again, it responds to changes in pH levels. Physicians, scientists know that pH levels are an indication of a possible leak, and therefore they can get an early ding, ding, ding warning signal.
Yeah. It's very cool that they're able to use that hydrogel, and I guess just the movement of the disc. I mean, it's such a simple solution, but it's going to make such a huge impact. Ralph, I don't know how much testing they're going to have to do, because it seems like this should just kind of work out of the box, and obviously they're going to go through animal testing to make sure that it doesn't do any additional harm. But this seems like such, again, one of those simple solutions that they can start implementing almost immediately. This is very cool.
Yeah. And so clever, and in some ways so simple in a sense.
Yeah.
But just absolute genius. So but it gets better. Here's the last comment, the last note from the show notes here. When the patient has fully recovered, let's say from pancreatic surgery, the biocompatible, bioresorbable sticker simply dissolves away.
Yeah. Oh, I'm sorry.
Bypassing the need for surgical extraction. No need to go in there and cut you open and pull it out.
Yeah, exactly. There we go. Yeah, exactly. And sorry, there's something going on I have to go take care of. But Ralph, let's go ahead and just jump right into story number 4 while I go take care of something real quick. And then
You got it. I
story
can
number
hear
4.
the doggy.
Yeah, I apologize.
No problem at all. So, folks, we'll pick up here with story 4 while Ben takes care of the precious puppy. The headline here, and this comes from Phys, Phys, short for physics.org. And the headline here is Implantable Batteries Can Run on the Body's Own Oxygen. And we have a wonderful illustration Ben has put up on the screen for us as we go through this story. And again, come out to computeramerica.com, get the show notes. We'll have the links, images, and so on for you if you want to dig deeper. So let's set the stage here. From pacemakers to neurostimulators, implantable medical devices rely on batteries to keep the heart on beat and to dampen pain. But batteries eventually run low and require invasive surgeries to replace. That's the problem. I think that's all very obvious. To address these challenges, researchers at the Tianjin University of Technology in China devised an implantable battery that runs on oxygen in the body. What? A battery that runs on oxygen in the body? The study, published in the March 27 in the journal Chem, CHEM, and we have a link in the show notes for this if you want to super geek out and get into the details. The study shows that in rats, the implanted proof of concept design can deliver stable power and is compatible with biological systems. To build a safe and efficient battery, the researchers made its electrodes out of a sodium-based alloy and nanoporous gold, a material with pores thousands of times smaller than a hair's width. Wow. Isn't that something, Ben? I mean, just the scale of this stuff, nanoporous gold. Okay.
I can't imagine it would generate that much electricity, but maybe enough.
Oh, you're right. You're going to find out. That's very astute because you're going to find out that is a reality check at the end here. So gold has been known for its compatibility with living systems. Think about the old days. They used to embed gold fillings in people's teeth. Mm-hmm. That's what they're talking about. So gold has been known for its compatibility with living systems, and sodium is an essential and ubiquitous element in the human body. The electrodes undergo chemical reactions with oxygen in the body to produce electricity. So it's a self-energy generating thing. I love it. To protect the battery, the researchers encased it with a porous polymer film that is soft and flexible. The researchers then implanted the battery under the skin on the backs of rats and measured its electricity output. 2 weeks later, they found that the battery could produce stable voltages between 1.3 volts and 1.4 volts.
I mean, that's not nothing.
Here's the Yeah, it's not nothing, but reality check. Although the output is insufficient to power medical devices, the design shows that harnessing oxygen in the body for energy is possible. And my comment here that I inserted, as this is initial research, you can bet these researchers will continue to work on this technology to increase the power output. So once again, folks, a good example of twinkle in the eye, early research.
I mean, from what it sounds like, Ralph, one rat is 1.3 volts. So if you just carry around a backpack with like 1,000 rats, hey, you got maybe something to power something.
Now there's an image.
Probably not what they intend.
And here's a final note here, and it gets better. Here we go. The team also evaluated inflammatory reactions in the poor little rats, metabolic changes, and tissue regeneration around the battery they implanted on the back of the test rats. The rats showed no apparent inflammation, so it's benign, apparently. Wow, what an interesting prospect for perhaps having sensors that could be in the body that generate their own electricity from the oxygen in our body systems. Wow.
Yeah. I've on the show, we've discussed a number of different ways to generate electricity to power, pacemakers is the big one. Insulin pumps is another big one, just different medical devices that always need electricity. And we've heard of mechanical, harnessing the movement of like the heart, for instance, or, of you walking and having a battery there. Ralph, there's a lot of different solutions solutions, and all of them could be viable. Like, mix them all together, and hey, this could just be another small thing to add just a little bit more electricity into your system. So there you go. And hey, we all can't rely on coffee all the time. So there you go. Story number 4, Ralph, and again, everyone, I apologize to what happened earlier, but hey, 4 great medical stories, and all of which I have not seen on the evening news. And I've seen a lot of stuff. So there you go. 4 great stories. If you want to check them out, computeramerica.com. And at the end, there are multiple honorable mentions that, we just simply don't have time for, because we're doing, honestly, a better and better job of trying to make this a more condensed show. And,
yes.
Ralph's doing great. So these honorable mentions are not worse. They're not, second place or anything like that. They're just don't have time for. So let's at least give them the headlines, Ralph.
You bet. And we've got 4 honorable mentions, all medical technology related. That's the theme for today's show. First one comes from medicalexpress.com. Headline: Scientists invent ultra-thin, minimally invasive pacemaker controlled by light? What?
I don't think there's a lot of light in my gut. There's a lot of junk, but there's not a lot of light. But interesting.
Well, you gotta read the story to find out what the heck they're doing. It's just great. Next one comes from sciencealert.com. Headline: New synthetic blood clotting system could help stop internal bleeding. Synthetic blood clotting system.
Cool.
Wow. Check it out. I mean, that's profoundly, the implications of that are huge, huge, huge. Next one from interestingengineering.com. Scientists create artificial mucus to probe early tumor formation. And that headline alone, you go, well, okay, artificial mucus, that's kind of cool. How the heck does that have anything to do with
they could have went to my dog who had a sinus infection and has a nose like about 8 inches long. If they wanted some mucus, there's better ways to do it, but synthetic is good. Synthetic is good.
If you want mucus, just my 3, 4.5-year-old, almost 5-year-old grandchildren will give you plenty of mucus, along with their nearly 3-year-old little boy.
They're more than happy to share. You just walk up to them and they'll hand it to you. It's great.
Oh, well, they'll demonstrate it, and I won't go there any farther than that. Okay, now, the last one here from ScienceDaily.com. Headline: Doctors can now watch spinal cord activity during surgery. It's another great monitoring technology advancement. So, folks, those are our 4 honorable mentions. And again, this week was all medical miracles.
All great stories. So, ladies and gentlemen, if you want to find out more, computeramerica.com. Ralph, you picked a great number of stories, and I know that typically our segments are varied. They can be anything and everything science and tech related. But I really do enjoy these just kind of focused ones where they have a theme. Makes it all the more enjoyable. So, everyone, thank you out there for joining us. And if you want to find out more, check out our website. Wherever podcasts are heard, you can hear the podcast. And Ralph, in the meantime, have a great weekend. Everyone out there, do something fun. We'll catch you next time. No show, actually. I have to announce this on the show. Sorry to wait so long. No show the 19th. So no show the 19th, everyone. Be aware, but we'll be back on the 26th. Everyone, have a great day. Thank you so much. Bye, everyone.